Now, in the wake of Roe v. Wade being overturned, more women are using online pharmacies to self-manage abortions. But advocates worry access to those medications could be cut off. Our Noelani Graf speaking with our ABC 15 health insiders about the risks and the misconceptions as well, Nohe, because we know there's a lot of misinformation floating out there.
Exactly, Allison. And a lot of terms sound very similar. And while lawmakers and judges work to define medical terms and timelines, the barrier remains up here at the state capitol. But doctors among patients are seeing confusion between conception and contraception, miscarrying and terminating. So our ABC 15 health insider is helping clarify those terms and also outlining the risks of taking the abortion pill without first talking to a doctor.
Let's start with the morning after pill. It's sold over the counter. You take it within 72 hours of unprotected sex.
It's important that people understand that this is a form of birth control. We call it emergency contraception, and this is not an abortion.
When Plan B doesn't prevent a pregnancy, the abortion pill is now becoming known as Plan C.
We use the term very loosely, abortion pill, but it is two different medications given at two different times.
ABC 15 health insider Dr. Janice Johnston says the term abortion pill can be misleading because it's also widely prescribed during miscarriage.
There is certainly misconception because the medical term that we use for a miscarriage that hasn't gone all the way is called a missed abortion.
In that instance, the medication helps clear the uterus and can save the mother from severe illness. But the process is similar for terminating an unwanted pregnancy. So some doctors may be hesitant to prescribe it now, prompting some women to order online. Dr. Johnston warns the medication isn't safe for everyone, like those with blood clotting issues or ectopic pregnancy.
We do actually see a fair amount of patients with those conditions. Sometimes they're unaware of that.
Online pharmacies charging $200 to $400, unverified pills, some coming from other countries, and you don't have to talk to a doctor before or after. That can be dangerous if questions come up.
What happens if things go wrong? How long is bleeding normal? What happens if I develop a fever? So there's things that can happen. Sometimes they might be normal and self-limiting, but sometimes they need help and they need medical directions.
Now, telehealth is also being used more in states where abortion is legal. But if you're in a state where it is not, then you need to be aware that there are different licensing laws when it comes to telehealth. Also, in the meantime, there are nonprofits like PlanCpills.org that are trying to connect women with physician-supported sites so that they still get that critical medical advice and understand the difference of what they're working with. I'm live at the state capitol in downtown Phoenix. Noelani Graf, ABC 15, Arizona.